Good morning, everyone. Just want to give an update. I just had my post-op visit for the Abbott permanent spinal cord stimulator install. It's been a little bit of an ordeal. First couple days after surgery was challenging to say. Made it through it. I'm up, moving around. I start physical therapy on Tuesday, and not really for sure if I'm ready for that yet. Having a little issues here and there, but that's going to get worked out. I have to go and get some x-rays done on Tuesday as well. So far, it seems to be following the course as I've been told, and I'll be able to start really feeling the benefits of the SCS. So for those that are thinking about using the Abbott, there's not much on YouTube or anywhere else as far as reviews go. I've seen a lot for the Boston Scientific, and I come close to doing the Boston Scientific to begin with a prior doctor, which was almost 2 years ago now. But having to go through 6 months of pain management before I could even see about doing a trial and everything else, it turned into complications going that route. It's not against Boston Scientific. It was just the way they do things. I'm sure that system works. I watched other videos on YouTube, people that have had great success with it. So the whole reason behind this, doing videos, is to help others that are possibly looking at going with the Abbott and wanting to know more about it. It's been 2 weeks now. The module that's in my left hip is starting to settle into a pocket. It's not bulging out as bad and not as sensitive. Wearing jeans with a belt or even sweatpants. It's just the incision was touchy. So the incision that's in the center of my back, the paddles that was used is at T8. So just right about center of my back. That incision has healed great. No issues with it. It's not tender or touchy in any way. When you get the module and they first turn it on after a 2-week post-op visit, to where you get more of the programs. They do have a program when you first have the surgery. But once you be able to use more of the programs to help with the pain and everything for me, it's in my lower back and my legs. So I'm just now getting to have that turned on and getting to use that part of the whole system. So I'm sure over time I'll know more of the benefits and start feeling more of the benefits. So as right now, it's tolerable, and then I still have a lot of pain stuff going down my legs. But I'm at the beginning stages. I'm at the very first start of all this. So I know it's going to take some time. My rep, Nicole, she's been great. She calls and checks on me. Or if I have any questions, I'll send her a text or call and leave her a voicemail. And she calls me right back as soon as she can, usually within an hour. And I know she's got other clients and other people to help out as well. So I'm grateful that she can call back as quick as she does. She's been fantastic. The surgeon I've got, his PA's been wonderful. Shelby, she's a sweetheart and has answered all my questions and taken the time to sit with me and talk without feeling rushed like a lot of doctors and PAs do. They want to rush in and rush back out within 2 minutes. She'll actually sit there and talk with me for a few minutes, and if I have any questions, she's there to answer them for me. So she's been great as well. So, would I do it again? Yeah. This is more of a last option for me. This surgery of doing the implant is my 9th back surgery. So, there's not much left I can do to be able to help control the pain. I do not take the pain medicines. I have a lot of allergies to different medications. There's 11 of them on my list that I cannot take. Several of them are opioids. So I have to watch medicine. So I don't like taking it to begin with. So medicine is not really an option that I even want to think about. Overall, I'm up, I'm walking, I'm getting around. I'm still using a cane, but I'm hoping within the next month, I go back in 4 weeks. I'm hoping in the next month that I'll be able to walk more unassisted and not have to use a cane. I do have a service dog, Odin, so he's always there with me. So with the Abbott, I'm really liking it. The trial was wonderful, and now moving on to this part of it, having the permanent implant. I'm excited about the future and being able to live life, be able to get out and do the things I still want to do. I'm 51, I'll be 52 in August. I still want to go kayaking, I still want to go camping, still want to ride my motorcycle and the Razor. The Razor's been sitting in the garage for 2 years because it's just too much for me to ride because I hurt so much. So it's been an ordeal for the last, my first back surgery was in 2004. So it's been a long road. The biggest thing that I can say to those that are out there thinking about doing a back stimulator, the spinal cord stimulator, is look at your options. Talk to your doctors about it. Talk to your family about it. And really decide if this is something you want to do. I'm liking it so far. I don't see any issues so far. We have some discussions to talk about with the doctor after the x-rays are done to double check a few things. But overall, it's doing what it's designed to do so far. And taking it one day at a time. At least I'm not going 1 hour at a time. Hour by hour. That's miserable. When they done the consultation, I had to speak with a psychiatrist, and I talked with him. They done some other tests and everything. And 2 of the doctors asked how I have dealt with the pain like this for so long. Well, the pain didn't come on instantly. It was gradual. It built up over time. And I just got accustomed to it, and it was just a normal. I was able to block it out and not dwell on the pain until it got to the point where it was affecting other parts of my body as well. And I really had to seek the doctor's help with this. I've got a high tolerance for pain, I guess. I've always been told that. When I've had other surgeries with anesthesia, they always have to give me the max amount. And I have had on 2 different occasions woken up during surgery to where I told them what they were talking about during surgery. So that's another issue with medications I don't like. I wish you all the best. And if you're thinking about it, leave a comment below, ask questions, and I'll do my best to give you an answer or basically my opinion. and hopefully that'll be helpful for you. And I wish you all the best. Take care and have a great day, and happy Easter.